So back to the why. Well, hormones. In women, we are losing our female hormones from our 40s. And although there is a fairly steady amount of testosterone, it's actually a relative increase because you don't have the estrogen to counteract those negative effects of testosterone. And we've got to think, is this lady thinking hard with her chin in her hands, or is she trying to identify those cheeky chin hairs to pluck out from that times 12 mirror a little bit later when she gets home? So looking at the mechanism, we start out with lots of hair. You can see that healthy hair density. But in time, with testosterone, which actually gets converted to DHT, which is 5 times stronger than testosterone, that will attach to the receptors in the hair follicle, where it will have its action of reducing that active growth phase and promoting the rest phase. So in time, you get progressive hair loss. The hairs come out thinner, shorter, and less pigmented. So do I sense some alarm in the audience? Well, help is at hand, and well done. At least you're here, so a bit of self-help. Your hairdresser has a great bird's eye view to point out any thinning crowns, or at least collaborate your feeling of your hair might be thinning. Your GP is great to possibly confirm the diagnosis, perform some blood tests, and consider your hormones. A trichologist isn't actually a doctor. There's somebody who's interested in the scalp and the hair, but they're not able to prescribe, but hopefully can direct you to some useful treatments. A dermatologist, particularly one with an interest in hair, is going to spend time listening to your history, carrying out a full examination, performing necessary investigations, and we can at least offer some prescription medication, and importantly monitor with hair photography, so you've got that objective view of whether things are actually helping or not. So starting with the promotion of growth, I like to think of this as fertilizer. Minoxidil is probably our first or our number one treatment that's got the most evidence for it. And this was a blood pressure tablet where 80% of users became hairy. So it was made into a lotion and then a foam, and really is probably the number one selling treatment over the counter. Other two to mention, stemioxidine and melatonin, which I'll go into a little bit later. So back to minoxidil, this is promoting hair to go into the anagen phase, be actively growing and stay growing. This will in turn reduce the hair cycles and thicken up those diminishing hairs. So Regain first got licensed for women as a 2% strength lotion, but doing that twice daily is quite frankly not practical. So I'd advise women to use the 5% foam once daily. And of note, the men's is exactly the same, it's just that the instruction is twice daily. So pick whichever is cheapest and just make sure you use it just once daily. So this is a patient of mine who, after just 4 months of using the minoxidil 5% foam, you can see, if I can get the laser to work, or not, sorry, the central hairline that's starting to thicken up, and also at the crown too. And I think 4 months of monotherapy, that is a significant early change. But after lots of research, it's deemed now safe to use minoxidil in tablet form, which clearly for some people is going to be a lot more convenient. And we use low doses, so lower than what would be used for blood pressure, so there shouldn't be any risks there. But this is a prescribable treatment. There are potential side effects, so you do need a doctor keeping an eye on you for that. And although it's inexpensive, supply issues sometimes come along, particularly after this article in the New York Times last year. There was a real peak in demand. So other promoters, so stemioxidine, this is in a kerastase serum, their serum Juness. And that is, they're describing it as awakening the dormant follicles, so pushing those hair follicles back into the anagen phase. And also has antioxidants in there, which is preventing loss of pigment, and ceramide to help hydrate the hair. Now, L'Oreal owns kerastase. They've got their own serum with the stemioxidine, which I suspect is just as good and at a lower price point. Melatonin people are familiar with to help sleep, and this actually increases estrogen receptors in the hair follicle. So that's going to elongate anagen, and it also has antioxidant properties, increasing pigmentation. And we can now do this topically, which I'll go on to later. So thinking about preventing this ongoing hair loss, we use anti-androgen treatments. So we want to lower that testosterone and block that DHT. So traditionally we've been using spironolactone, and this is reducing the amount of testosterone you make. And this is also useful because it will reduce the unwanted hair on your face. It will reduce oil production for those who have oily skin types, and also reduce any hormonal acne. Dutasteride is the drug licensed for male pattern hair loss, but we use this off license for women, along with the more potent dutasteride. And dutasteride can be injected now. That's called dutasteride mesotherapy, but it's not for the faint-hearted, as it will be uncomfortable. Again, we can use these topically, and research is showing that oral anti-androgens arrest hair loss in about 90% of women, and up to 40% will experience regrowth with the oral anti-androgen treatment. So what's new really in the last year is that we've got compounding chemists who are able to make up topical solutions. So I can select which active ingredients to put in, I can choose the strengths, and can really personalize what is right for that individual. So bottom line is that combination therapy is best. And here is a lady in her 50s that was referred to me with really advanced female pattern hair loss from a transplant surgeon. And I was a bit concerned that I wouldn't be able to do anything to help. But actually using oral minoxidil along with oral finasteride, here's her at 6 months and also at 12 months. And this has been absolutely life-changing for her, so much so she doesn't want a transplant. I would have thought maybe it'd be tempted just to fill in those final gaps, but I think she's just very happy to persevere with this, and she's functioning really, really well. Just quickly touching on natural anti-androgens, as you may have heard of these, there is limited evidence, and a lot of the delivery forms is in shampoo, and I personally don't think shampoo stays on the scalp long enough to actually absorb into the follicle and have true benefit. You rinse it off just too quickly. So maybe in time we'll be able to refine these to medical grade and add them into the topical solutions, but for now I think it's a bit hit and miss. Medical management with HRT, you would have heard a lot about that from experts today, but really of note for hair, estrogen extends that actively growing phase anagen. Natural progesterones are thought not to have an impact, positive or negative, but the synthetic progesterones will actually exacerbate hair loss. Testosterone will have a negative effect on hair growth. So really, if you're wanting the best HRT for hair growth, it would be micronized progesterone with estrogen and without any testosterone. A few other complementary treatments. There is some evidence, although modest, to support Viviscal to push hairs back into anagen phase from telogen, and the newer kid on the block is Nutrafol. Evidence is limited for both. The laser comb, this is quite expensive. This requires 15 to 30 minutes daily use. And some people might notice a reduction in hair fall and increased hair growth, but again, data is limited. PRP is where blood is drawn down, spun down, and all the good growth factors taken out and injected back into the scalp. Again, a bit uncomfortable, and we don't really know for how long you'd need to continue this treatment to sustain whatever benefit you might have, and that's similar with the newer stem cell transplant treatment. So if our medical treatment is failing, or you can't tolerate certain treatments, or there's medical reasons why you can't have some of the drugs we use, got to think about camouflage, and a good hairdresser will help you get the best style for you. There are great coloured sprays, so L'Oreal Touch-Up Spray or the Batiste dry shampoo has a colour range, and patients find that really helpful. Along with hair fibres, it's a bit of an art to learn how to shake these in so you don't get a big clump in one place, but they really give volume and improve the hair density. There are much better quality toppers and wigs these days, and also hair systems. So Lucinda Ellery invented this interlace system where you've got a piece of net on your scalp. The good hair is being pulled through that, and extra hair is being tied to the lace rather than your scalp, so you're not putting extra pressure on the hairs themselves and causing them to pull out. And just a note, hair transplantation is not just for men, it is for women too, and I think when you've got focal areas it can be really helpful. But you've got to be careful in the transplant surgeon that you choose. You've got somebody who's got a lot of experience, who's reputable, who's going to meet your expectations, because you've got to have enough hair in your donor site to fill in the gaps. And also there are lots of different types of hair loss, not just female pattern or androgenic alopecia. And some of these types of hair loss should not be transplanted. So thank you for staying and thank you for listening. And any questions if there are time?
Thank you so much. Yes, we do have time for questions. Would anyone like to ask anything? No questions? Okay. I've got one. What with the transplants, can you talk a little bit more about when it's time for a transplant? What's the difference between a non-surgical option and going for that option?
So medical treatment should always come first, because you want to optimize everything you can do, and if there is still persistent areas, then I think that's the time to consider transplant whilst continuing your medical therapy. As I say, you've got to have a good donor site, so they're either going to take out a strip of hair from the back and conceal that and cut out all those little follicles in order to put them in, or they'll take out individual follicular unit transplant little hairs to pop in. So I think definitely get your medical management straight first and then go to the transplant.
Yeah. And how do people find the right expert to give them this advice? How do they find people like you who are specialising, and particularly in female hair loss, because we hear so much about men, but what about finding the right expert for women?
So we have the British Association of Dermatologists, and within that we've got the British Hair and Nail Society, and there is a list of sort of accredited experts to seek advice from.
That's brilliant. Thank you so much, Nicola. That was excellent. You are around if anyone would like to chat to Nicola afterwards.